If you're having back or neck pain, stay tuned. The program you're about to see can help you.
Getting well is a priority for everyone. Our health should be the first priority, and we have a responsibility to take good care of it. Welcome to Getting Well with Sam and Annette Bailey. This unique program is designed to bring the latest innovations in medicine to you. And now, here's Sam and Annette.
Welcome to Getting Well with Sam and Annette Bailey. Our guest today is well-known country music artist, songwriter, Grammy Award-winning, op-ed columnist, Larry Gatlin. And Larry, Annette, and I really appreciate you joining us today for this
Thank
talk.
you. Glad to be. You left out Grandpa with all of that
Grandpa.
honor roll, Grammys. Grandpa. That's the best thing. Oh, Doc, I'm a new man. I mean, I this morning I woke up with a little bit of soreness in my back, just a little bit, kind of my belt back there, where horizontal, a little bit. Let me tell you something. A little bit of soreness is a whole lot different than a whole lot of pain. You know, I was 15. A friend of mine kicked me in the back. He didn't do it on purpose. We were playing football in the backyard in Odessa. Tommy News, his name, and we were in Randy Walker's backyard. And he ran at me, and I fell.
In case they're watching today.
In case you're watching, you dirty dogs. And he kicked me in the back, and they literally had to pick me up and load me in the back seat of the car and take me 2 blocks down to my house. And from that day forward, for the next 47 years, there has not been a single day in my life that at some point in time during that day, that pain didn't shoot down out of my right cheek there and down my leg. Some days worse than others. But it just finally, after almost 3 million miles on American Airlines alone, and a bunch more miles on Southwest and all the rest of them, sleeping in buses, sleeping in hotel rooms. I've only played 11 rounds of golf in my life, so it wasn't golf. I'm sorry.
Yeah.
We just play on days of the week that end in Y.
There we go.
So, you know, like I say, in and out of airplanes and the things that we've done, and we've been very active. And I've been a runner. I've run in the snows of Moscow and the left bank in Paris and London Bridge and Central Park. So, have had a very active life, but it has always been my constant companion. So, the last year ago, I had my knee scoped. And I think the kind of favor in that knee really is what just finally pushed all that stuff so far out of line. So, so I feel great. If it's, like I say, what little soreness there is there that I know you'll explain to these nice folks. It's, 2 Advil 3 times a day, Diet Coke, Lord's Prayer, I'm ready to go.
Well, Larry, your story is indicative of a lot of people. The problem with pain associated with the disease or injury of the spine is literally an epidemic. There are 85 million Americans today suffering with what you're describing, with pain that's across their lower back, shooting down through their buttocks and into their legs, and a lot of folks with problems with their cervical spine, with pain that radiates down into their shoulder and down into their arm. A lot of folks don't know this, but there are 1.2 million spine surgeries performed every year in the United States, and 400,000 of those fail. And so you've got a lot of folks that are struggling with not only the pain that originated through disease or injury of the spine, but then a lot of folks suffering because their procedure did not work. A lot of folks have been following your career for a lot of years. And have
So
been
we're going
very
to talk about me?
We're going to talk about you.
Oh, that's good,
We're gonna talk
boy.
about you.
We've been a long time without talking about me.
Well, do you know that every person that is hurting today has their own story?
Sure
and
they
I
do.
promise you that people that are hurting, lower back, mid back, thoracic spine, or the cervical spine, they all are interested in your story, because as you talk and tell us about your life and things you experienced, they're going to identify with parts of that. So.
Well, I hope that we can, bring them some relief and bring them the information. And I know you'll do the technical stuff. Here's what I want folks to know at home, wherever you are. I found out about these nice people. I mentioned American Airlines a while ago. I was sitting there with something, a blanket or something rolled up in the back to try to get a little relief. And I read The American Way, out of the little pocket, the seat in front of me. Something about that that little picture in the page that said, Larry, go do this. Go do this. You need to know something. These folks didn't come to me and say, let's make a commercial. So when I got home, I had my 9-year-old and 4-year-old granddaughters, Parker and Campbell, get over on the computer with Papa and show him how to work it and how to turn it on. And we Googled, I looked it up, found it, called Miss Thedford, Kimberly Thedford. She called me back, and every day she would call me at least once a day and say, how are we doing? What's going on? She stayed in great touch with me. First had the epidural to try to see if that worked. Dr. Will said, hey, let's don't do any more than we have to. See if, he said, I've had that work sometimes. The shot will take care of it. Well, that didn't work in my case. So I told him, I found a day, 3 weeks hence, that I could do it. I said, Doc, I'm a recovering alcoholic and drug addict, and I don't want you to have to give me drugs, but I've got 3 weeks of work to do that I cannot turn down. For myself, for my bills, for my band. See, we made a lot of money, Doc, but I was always good at making it, never was very good at keeping it. And I'm trying to run out of money and breath at the same time. And I might all slow down a little on one of them. So I went in there, I said, for my band and for the folks who've bought tickets for the next 3 weeks, I said, you give me something that will keep me on that stage for 3 weeks, and I will get back here. So we went in there, we did it. The people were incredible. One of the nurses came in and said, Brother Gatlin, how you doing today? And I said, I'm a greatly blessed, highly favored, imperfect, but forgiven child of God. She said, hallelujah, let's lay hands on you. So we had a little Pentecostal revival right there. I don't know whether you can use that or not, but I think it helped a lot. And all I know is my old Pentecostal grandmother had 12 kids without any anesthetic. They were doing some praying. So, I just had a wonderful experience. The anesthesiologist came in and he said, I'm the one who's in charge of the music in the operating room. Do you want to hear all the gold in California? I said, no, I want to hear Elvis Presley's version of my song, Help Me. So they rolled me in there, and right before he put me under, he was going, Lord, help me walk. The music was coming over the loudspeakers, and the gas passers go, do Elvis. I mean, it was a wonderful bunch of people. I walked in at 11:30. I walked out at 2:30. In the next 10 days, I took 2 halves of a Darvocet for the pain, and that was only because I had to fly didn't have to. I got to fly to Toronto and sing with my brothers and fly back. From then on, it has been Advil. Before I ever knew you, Doc, and you, Miss Annette, I told everybody I knew, because everybody I know has back problems, my dear friend Roy Clark. I love the man. He's one of the sweetest people on earth, a great entertainer, has had more back surgeries, I said, Roy, I don't know if what you have is something that these people can fix, but go check it out. Let them see. Because, he's bent over and he can't hardly walk. And, everybody. And then, you called me and asked if I would come and do this. So gladly. My father, honey, what's he, Daddy had 3 or 4 where they cut you open like a watermelon.
Open surgeries.
And I know sometimes they have to do that. My brother Rudy's had 2 or 3. So I am a believer that when you called up and we visited and I told you if it's never what little discomfort is, that you've promised would go away in 6 months, I'm going to call you. But folks, it's
statistically
miraculous.
It goes away.
Okay,
It depends on how hard you hit that driver and whether you...
I tell you what, I'm going to swing at it as hard as I can. I might hit it. So I am very grateful, very pleased. I am not a paid actor giving you a spielola about this. Look, they made a little incision about that. I'll let you see it. It's right about in there somewhere. And one little stitch. That night, Janice and I went to bed. That we stayed in Dallas that night. And the next morning, there was a little bitty drop of blood on that sheet. We tried to wash it out with some soap and water. And that's it.
Yeah.
I'm a happy camper.
Larry has so much valuable information about his own experience with the spine, But you know, this is a problem that affects 85% of all Americans at some point in their life. Now, in just a minute, we're going to get back to Larry and his story, and there's a lot of interesting things that he's going to be telling us about his post-surgery experiences and what he's doing in the country music field today. But for just a moment, I want to tell you about how that I personally have been able to help over 20,000 people who are suffering with pain created by impingements of the spine, nerves that are being touched by herniated discs and bulging discs and spinal stenosis and disc degeneration disease and all of these diagnoses that you hear about and maybe that you're experiencing today that's creating a lot of pain in your life. Spine pain is one of the leading causes of disability in the Western world. The leading cause of disability is heart disease and cancer, and right behind that is failed open back surgery syndrome. My friend, we want to help you avoid traditional open back surgery with a fusion if we can do that at all. A very few people in our population actually need a fusion. And for those that need that, we're the first company to tell you that that's what you have to correct your problem. But for those who do not need that, why would you want to put your body through that debilitating experience of creating all of that damage to access those impinged nerves when we at Renew Spinal Care, our partner physicians, are able to access through 1/8 inch incisions? Not that large incision that exposes the entire spine and the body to open air infections and other kinds of problems. Not that large incision that can create bleeding and actually cut nerves and even create, in addition to issues resolving or relating to even sometimes death in that surgery, but also to paralysis and permanent nerve damage. When we can, through a 1/8 inch incision, access these openings where the nerves exit from the spinal cord, and we're able to get down into that area without having to go through muscle and bone and fatty tissue and ligaments and tendons. We come in from the side with our approaches, and we are able to access the entire length of the lumbar spine in one anesthesia experience. Now, this anesthesia is monitored anesthesia care. You do not need a ventilator. It's light general anesthesia. You're ambulatory after the procedure, as Larry has talked about. You walk out of the surgery center. You spend the night in a hotel, or if you're near one of our centers, you come in the next morning and we do a post-op treatment evaluation, and you are on your way after that happens. Now, if you've got a problem with your cervical spine in the neck, radiating down the shoulders and the arms many times, rather than removing bone, as is a prominent and a common approach to resolving these kinds of issues, and then fusing the spine. Now, let me tell you about a fusion. When you fuse these vertebrae with plates and screws, you put 100% stress on the bones and on the discs above and below the fused area. And when you do that, you're probably guaranteeing that you're going to have another surgery later in your life. As a matter of fact, the average person who has at least one open surgery will have 2.5 surgeries on average in their lifetime. And so we're trying to help people avoid that. And I personally, as the owner of Renew Spinal Care, have had 2 spine surgeries. I know what you're experiencing. I know the pain that you're going through. I know what it's like to lay awake at night and not be able to go to sleep, afraid that if you do wake up, you'll never go back to sleep that night, sitting in a recliner, flipping through the channels on television, reading, walking around, but not being able to rest. I know the danger of narcotic medications. None of us want to go there. And if you are there, you want to get off of those medications, because research reveals that there are a myriad of side effects with these kinds of medications, including possibly the cause of cancer. And so we want to get off of those narcotic pain medications. We can probably help you at Renew Spinal Care with very small incisions, with the latest technology, Our doctors are able to directly visualize the source of your pain. We can actually see what it is that is generating the pain in your body. And then through these tiny incisions and through tiny tubes, we're able to utilize all sorts of different kinds of devices, including heat devices like the laser, to go in and to remove the impingements and remove the inflammation and to help in those areas where the body's trying to heal itself. And we actually see that in real time, magnified many times on a screen while the physician is operating. We have patients coming from private insurance, from self-insurance, from workers' comp, from medical tourism, from nations all over the world to access this technology. My hope and prayer is that perhaps we can help you at Renew Spinal Care to resolve your issues. Please go to our website, call the number that you see on the screen. We have a dedicated staff of people. Someone is waiting to take your phone call right now who can help you to facilitate and to go through the steps that you'll need to show you what to do so that you can be a recipient of this cutting edge technology. So call us right now. Pick up the phone and call. Go to the website. Let us help you. It's our prayer that you can live a pain-free life.
For those that are joining us now, we've got Larry Gatlin here with us. And tell everybody how you first heard about the company.
When I brought my iPhone home, see, all it was this little black deal. It just had one little indent. I didn't know what, it didn't have any buttons or knobs. And our granddaughter Parker said, "Let me see it, Papa." And she turned it on. She said, "Papa, what's your password?" And she downloaded 2 games before I could get it away from her because she knew how to do it. And they'd already set up my password.
Our granddaughter's the same way.
So we got on the internet that day and found, yeah.
You talk so much about your family. So what are you? What are you and Miss
I'm
Janice?
Papa, and Janice, they call her Ishi. Her nickname for her mother was Jancy.
Okay.
And we thought that'd be a cute grandma named Jancy. Well, Parker couldn't say Jancy. It came out Ishi, Ishi. So it's Ishi, I-S-H-Y. So that's what they call
When
it.
you were in a concert, though, you wore a ring similar to this. And so it's not his wedding ring, I don't think, but it's one of your grandkids' rings.
Here's what happened. Years ago, I was playing golf in Austin, and I always would take my wedding ring off and put it in a little, leather bag with my watch and my money clip and all that. Well, when I got out that day and took stuff out of the bag, for some reason I didn't get that ring on there, and I lost it. I couldn't find it. So Parker, she's 10 now, she took one of those little bands off of her hair, and we rolled it up and put it on there for a wedding ring, and I wore that around until I got another one. So that's what happened that time. Well, as fate would have it, I'm gonna put it right there for the time being. I'll be back. During the epidural, Janice was with me during the real procedure, but when we tried the epidural first, she wasn't with me. I went to Dallas, and my brother Rudy, was there taking care of me. So, you take your clothes off and you put your watch and all that stuff in that little sack. And I was still groggy, trying to come out from under the stuff. And somehow he and I lost that little bag that had my wedding ring. So we got home. When I got home to Austin the next day, I saw Campbell, the 5-year-old. And kids noticed everything. She said, "Papa, where's your ring?" And I said, "Well, honey, we've lost it. We've got some people looking for it." And it was strictly mine and Rudy's fault. But she said, "Let's make one." And we took it out of her hair and did that little out of her silly bands or whatever. So today, when you came in there and said that you had remembered that you saw that when I sang a little song about it, I thought, that's doo-doo-doo.
Yeah, I did.
So,
so who would have thought a few years
I know,
later?
that's crazy that it really happened.
And so we're talking about family, but we're talking about back surgery. But I'm telling you, it affects your family.
Oh, good Lord! I couldn't pick them up.
Totally.
Yeah.
I'm a back patient as well, and so I do know how that goes. And so you just get to the point where am I going to be able to pick up my grandbaby someday?
Right.
And until the surgery, until you have the surgery, until it works, and there's so many people out here watching, and they want help, Larry. They just want help. they want help to the point that some people are right now even contemplating suicide.
I wouldn't doubt it.
And it's awful. And we want to prevent that because there's a lot of, I have talked to patient after patient after patient, and their wives are leaving them or their husbands are leaving them because they're depressed. And so it's just a lot of stuff that goes on. So family, it is a big part of this. And I don't know, I don't know what you went through, but family is a big part of pain.
I couldn't pick them up. And what it does, it just puts you, it puts you in a non-grandfatherly mood most of the time. It is debilitating. And I lived with it off and on. And I know that a lot of people have gone through it and had it a lot worse than mine was. But finally, the last 3 or 4 months, and I would try to do exercises, that McKenzie technique, I would try to do that. And for years, that kept it enough at bay that I was not just totally debilitated. But even if we're not just for the pain, which hurts, pain hurts. This just in, newsflash, pain hurts. It drains you of your energy. It just, you want to go out and play with the kids. You want to do and you just, it can't help but, be terribly depressing and such a downer. So, like I say, it's a miracle in my life. I'm grateful for it.
Tell us about Greatly Blessed. Tell us how that came about.
I have a friend, Nito Cobain. Nito came to America, I think, with $25 in his pocket. Couldn't speak the language. Taught himself to read and write. And he's now the president of High Point University in High Point, North Carolina. And we also, there at Guilford Technical Community College, a little 2-year college, we have the Larry Gatlin School of Entertainment, believe it or not. A bunch of kids going there and learning how to do.
They're in High Point?
In High Point. But I met Nito years ago, and he's a wonderful motivational speaker. And when you call Nito, he's the most up person. And I'll say, "My friend, how are you doing?" He'll say, "Larry, I'm greatly blessed and highly favored." So I added a little to it, and my friend Bill Gaither called me about 6 or 8 months ago, and he said, "Larry, how?" I said, "I'm fine." I said, "I'm greatly blessed. I'm a greatly blessed, highly favored, imperfect but forgiven child of God." And he said, "Well, we've got to." I said, "Write that?" "Yeah, we got to write that." So we got together a couple weeks later, and we wrote the song. And it was really neat. I really liked it. He called me back about 6 weeks later, and the vocal band recorded it. He said, "We need." I don't like. We need. I said, "You want to change it?" He said, "Yeah." He said, "I want it to sound like all the gold in California." He finally got it out. I said, "Well, we don't have to call anybody and ask permission. We can do that." So we changed it. It's greatly blessed.
Sing it with me, baby.
And highly favored, imperfect but forgiven child of God. And it's just the same. She's good. She's got the right.
Yeah.
So we did that. They're wonderful people, and they have been a great blessing in my life. Period. The music, all the old my heroes and Bills are the same folks. James Blackwood and Jake Hess.
We attended one of your concerts here.
Singing,
We're actually in Branson, Missouri, recording this, and we were attending one of your concerts years ago, and you challenged the crowd to name a hymn that you and Steve and Rudy could not sing.
That's right.
And they could not name a hymn that you guys did not know the words to.
We are very seldom stumped, very seldom. And when they do stump us, I say, well, what I meant was we know every single gospel song ever written in the history of the world that is in the Assembly of God hymn book. That one you wanted ain't in there, and that doesn't count. So we were raised in the church singing those songs, and so I'm greatly blessed.
Yes, you are.
You know what is really amazing? Obviously, the first 2 or 3 nights, you're afraid to sneeze, you're afraid to blink your eyes, afraid to go. It never kept me awake one time. Not one time. I never feel it. Just rolling out of bed or whatever.
Would the pain wake you up at times?
Before?
Before, yeah.
Oh,
Affected your
Lord.
sleep?
Only when your eyes blink.
Really? Yeah.
You'd roll and you just couldn't,
Then you couldn't get back to sleep.
This way, and you move your leg this way, and it just, no, it wasn't. It was no good. So, yeah,
And
that's the deal. I've seen a lot of, promotions with moderately famous people doing stuff, and I kind of always look at it like, come on. Please don't look at it that way. we have a saying in this other bunch of people that with whom I meet on occasion. Our saying is, the only surefire way to stay in perpetual darkness is contempt prior to investigation. So I did not want to stay in the dark about what was going on in my body with my back. So I investigated. It sounded right. I went and met with these nice people, and they fixed it.
There you go.
End of story.
You're in a very creative time of your life right now.
I really am. I love my life. I'm comfortable in my skin. I have a wonderful wife of 41 years, 2 great kids, and the 2 little girls. Steve and Rudy are doing well. And you know, after 17, 18 years of not having a hit record, we're with Curb Records. Mike Curb, a wonderful God-fearing man, gave us a record deal, so we've released a CD. I am going to New York a lot. Life is really good. It's really good, but I wouldn't be able to do any of that stuff. It would be very, very much more difficult without being healthy. So I look forward to every day.
Well, you know what's gratifying to us is that if what we have done has helped you to be more creative, because here's something people don't understand. When you're in chronic pain, you lose at least 80% of your ability to be creative. Now, I want you to stop and think about that for a minute. Chronic pain robs you of at least 80% of your capability of being creative. Why? You're thinking, how am I going to get out of bed? Right. How am I going to go to sleep? How am I going to stay asleep? How am I going to get to work? How am I going to be able to get to this event or that event or make this trip? Or am I going to have to miss this? And so your mind is consumed, and your brain power and energy and your imaginative abilities are consumed by just navigation.
Sure.
How do I get through life? All right. So now you're pain-free basically, and moving forward, we hope to 100% being pain-free. And so if we've helped to restore some of that creative ability in you, because you're not having to worry about, if I wake up, do I go back to sleep? Or how am I going to get in the plane?
Yeah, get
almost
in it.
said it.
Get in the
plane,
get in
the
plane.
bus, get to this place or that place. And then you can write these columns and write these books and write these songs that continually bless people and encourage people, as I have through the years.
Well,
then
I appreciate
that's
that.
great.
Y'all have been a very big part of that, in the last few months, and I believe, going forward from here.
Well, Annette, this has been great.
This has been great.
Awesome.
It has been a pleasure to meet you, Larry.
Thank you.
You are just such a real funny person. You're funny.
I am?
Yeah, you're hilarious.
Say that right now.
He's hilarious.
He's funny.
He is hilarious. But you're serious too.
Oh, Lord.
And
I hope you've enjoyed the program today. Please pick up the phone, call the number, go to the website. If you or a friend or a loved one is having pain related to the spine, the neck, the mid-back, the lower back, Renew Spinal Care can help you. We can give you valuable information and direct you to the right physicians who can help you to live a pain-free life. Call today.